Hi, my name is Dr Peter Jurcevic. I'm an obstetrician and gynaecologist, and I have 26 years of expertise, and I have special interest in both high-risk obstetrics but also in the natural aspects of the birthing process. It's my pleasure to provide you with advice and care. I would like to talk to you about obstetric care, and I'm going to focus on a low-risk pregnancy. When you're considering having a baby, we encourage you to be fit and healthy, to take a preconception multivitamin which has folate in it, which is to help to reduce the risk of spinal cord defects in your baby. And you may consider going to your local care practitioner and getting a blood test to check your rubella immunity, and there are even some genetic tests that you can have to check carrier status for certain things, such as cystic fibrosis. If you're considering going for private care, we would encourage you to check on your private insurance status. When you fall pregnant, as evidenced by a delay in your menstruation or a positive urine test, you would speak with your care provider to determine whether you were going to go public or private, and should you come to see me privately, I would normally see you around the 8th to the 10th week of the pregnancy. I'd introduce myself, take a full medical history, examine you, and then perform an ultrasound scan to confirm the viability of the baby, give you your first photo, and determine your due date. At that point, I would start discussing some of the investigations that are required. The usual blood tests that you would do would check your blood count, your blood group, a few infection parameters, and there would also be a blood test that would be offered to check the baby's genetic status. There are different tests that have different price points and different statistical validities, and I would go through each of these with you on the day. You would usually then be offered an ultrasound scan also at the 13th week, which is another assessment of the baby, both genetically and also to assess viability, and you'd also be given paperwork to book an ultrasound scan for the 20th week of the pregnancy. Generally, for a low risk and uncomplicated pregnancy, we don't need to see as much of each other for the first few visits, and we might have visits spaced every 6 weeks. So for example, if you came in at the 10th week, I wouldn't see you again to the 16th week, perhaps not again until the 22nd week. At each of the visits, I'd be inquiring on your health, physically how you're feeling, offering any support for any problems you might be having, always checking on the baby's health status by performing an ultrasound scan, seeing that it's growing appropriately, checking its heartbeat, and also be doing a baseline check of your blood pressure with reference to later in the pregnancy when blood pressure can occasionally rise. As we start to get into the latter stages of the second trimester of the pregnancy, and in closing on to the third trimester, we would start to see each other a bit more frequently. Normally at the 26th week, we would offer you a test to check for diabetes in pregnancy, and at this stage we would usually recheck your blood count and your iron stores. From that point onwards, we would usually see each other every 3 weeks, just so we can be a bit more vigilant on assessing your growth and also blood pressure. In the last month of the pregnancy, I would probably see you at least every 2 weeks, and maybe weekly in the last week or two up until your due date. Once again along the way, I've been inquiring on your health, assessing the baby's growth and development, doing ultrasound scans where necessary, and obviously answering on all questions that you might have. I would of course be having a very frequent conversations with you about birth preparation, which is something that I'm very passionate about. I would like to talk to you about some common problems in pregnancy. One of the most common problems is nausea and vomiting, otherwise known as hyperemesis. It can be quite variable, and despite its name, morning sickness can in fact often last throughout the entirety of the day. For a lot of women, something as simple as resting, keeping your hydration up, and having regular small portion meals can help to get you through to about the end of the first trimester, the 12th to the 14th week, when the hormone levels start to drop off a bit more, the placenta kicks in to help to keep the baby progressing, and you start to feel better as a result of it. For other women, unfortunately, they are very sensitive to the hormone rise and will need to have support. Support may be something as simple as taking some Maxilon, which is a low-risk drug that we can prescribe, and even some B6 or ginger supplements. For others, we might need to prescribe slightly stronger medication, once again always safe for the baby. And for some women where it's really bad, you may need to be brought in to have some IV fluid hydration, which can sometimes help to break the cycle when you're feeling quite unwell. For really severe cases, we can even prescribe you with some steroids, which can help to reduce the level and the severity of the vomiting. Heartburn is a very common problem in pregnancy, and it's because of the increasing growth of the baby in the uterus pressing up on your stomach, and also the hormones which are keeping the uterus calm and quiet, but unfortunately relaxing the small sphincter, which helps to stop the acid from going from the stomach up your food pipe or your esophagus. For some women, simple dietary changes, things such as soda water or a glass of milk, can help. For other women, they will need to get some non-prescription medications over the counter things like Mylanta, Gaviscon, Quickies or Rennies. For women who needing to use large amounts of this or simply really struggling, there are some prescription medications that we can give you, and one of the common ones is Losec. This can be really, really fantastic for women, particularly in the latter stages of pregnancy. Women often ask, when will I start to feel my baby move? This will usually depend on whether it's your first or subsequent baby. It will depend on where the placenta is located in the uterus, and also just how sensitive you are to movements. The usual early onset of movements, otherwise known as a quickening, is at usually about the 16th week, but can be as late as the 20th week in the pregnancy, particularly, for example, if the placenta is implanted on the front wall of the uterus, effectively acting like a large cushion in front of the baby, and the baby simply needs to be bigger and stronger for you to be able to feel those movements. If you're ever worried about movements in the early stage, it's very easy for us to do an ultrasound scan or a fetal heart check for peace of mind. In the latter stages of the pregnancy, we use fetal movements as a determination of fetal well-being. You'll be pleased to know that even when a baby is quiet in late pregnancy, in well over 98% of the times, the baby is actually well. But whenever you have a reduction in movements, we encourage you to call us so we can do an assessment for reassurance. Musculoskeletal pain in pregnancy is very common, and I barely have a day go by in my private consulting where I wouldn't have a conversation about this. Back pain, hip pain, pubic pain, even pain in the rib is very common, and unfortunately the hormones of pregnancy, which are designed to help to keep the uterus calm as your baby grows, unfortunately don't discern between other parts of your body, and where joints start to soften, you will get joint shifting and joint pain as a result. If unable to manage this pain on your own, it is important that you seek some expert advice, and we would recommend that you go and see a physiotherapist. And there are certainly things you can do in terms of SRC shorts or supportive braces around your pelvis which can help to improve your pain. People are split between choosing to find out the gender of the baby during the course of the pregnancy or waiting for the surprise at the birth. For those people who wish to find out the gender of the baby prior, there is a blood test that can be performed at the 10th week of the pregnancy, otherwise known as non-invasive prenatal testing, NIPS testing, which is 99.5% accurate at assessing the baby's gender, as well as, perhaps more importantly, assessing the baby's genetic status with a view to excluding major genetic problems. For those people who choose not to get this blood test done, usually at the 13-week scan, they can detect the sex of the baby with about 96 to 97% accuracy, and then at the 20-week scan with about 99% accuracy. 3 common questions with 3 simple answers. It is okay to have coffee in pregnancy, and certainly even 2 cups a day would be fine. Exercise is fine. It is just suggested that you exercise in moderation. Interestingly, when you walk in pregnancy, you're effectively jogging. If you jog in pregnancy, you're effectively running as a consequence of the physiology in your body. If you choose to wear a heart rate monitor, we simply suggest that you keep your heart rate ideally under 150 beats a minute if you're going to be doing prolonged exercise. And third, and perhaps most importantly, hair dye is fine.